afternoon, everyone. Thank you for being here. My journey to understand aging and government services for seniors started about 5 years ago. My mother was diagnosed with dementia, and at the same time, my father, her partner of 56 years, and her devoted caregiver died. So we lost my father, and overnight I became her caregiver, her advocate, and her system navigator. At the same time, something was happening at work, and I work at city government. I work for the City of Toronto and city government, and council was just deciding, based on a motion from Councillor Josh Matlow, to direct staff to develop a Toronto senior strategy to deal with the fact that the number of seniors in Toronto is going to more than double over the next 2 decades. So Councillor Josh Matlow passed that motion, it passed unanimously, and then it was assigned to staff. I became the lead staff person at the Government of Toronto to lead the development of that strategy. So at the same time, I was learning about and encountering this system with my mom. The system of long-term care, the local health integration networks, the community care access centers, the hospitals, the ER, the paramedics. It seemed like nobody was talking to one another, and I was having to try to understand this system, both personally and professionally. One of the first things I did was try to identify some aging experts and some community partners to help the city to develop this strategy. We were so lucky to find Dr. Samir Sinha. He is the architect of the Ontario Senior Strategy, and he agreed to co-lead it with us. At that time, he was working on his recommendations for the province. At the same time, we were working on our recommendations for the city, and we hitched our wagon to his star and have never looked back. We have learned so much from Dr. Samir Sinha. I'm going to give you just one example. Park benches. Have you ever stopped to think about park benches through the eyes of a senior? Seniors need park benches to be at least 22 inches high. They need them to have armrests so that they can get back up from a sitting position. But that also works for pregnant women, for people who have mobility issues, and other physical limitations. It's also really important that seniors have those kinds of benches throughout the city so that they can continue to be mobile and active and engaged in their communities. So we learned a lot, and we learned essentially that that old adage that if you design for the young, you exclude the old. But if you design for the old, you include everyone. So as part of the Toronto Senior Strategy, we put in another 1,000 benches in the city, and we realized that by looking at things through the eyes of a senior, we're making city improvements for everyone. So part of my role as the lead for the Toronto Senior Strategy, knowing nothing, just being thrown into this world in my personal life, was that I tried to understand this system of government services for seniors. So I sat at my desk and I started to draw out all of the federal programs, departments, services, ministries that were involved in services for seniors, and then all of the provincial, and then all of the municipal. And even without looking at the community-based not-for-profit sector system of services for seniors, it was a morass. It looked like the New York City subway, a map of the New York City subway station. It was just so convoluted and confounding. So I learned 2 things about that system. Number one, even though municipalities are constitutionally only a creature of the province, we have a lot of important levers for seniors. When you walk through your neighborhood and think about the roads and how long you have to cross at a traffic light, and libraries and parks and community centers and public transit and social housing. All of these things are things that are controlled municipally. So even though we don't have any real constitutional status, there's a lot that we can do for seniors. The second thing I want to say about that system is that the way that government services for seniors are organized, delivered, and managed disadvantage vulnerable seniors and their caregivers. So the challenges of aging can sometimes intersect with and amplify other existing vulnerabilities related to mental health and addiction, language, literacy, citizenship, where you live in the city, your income, and so on. So when we make government services so difficult and intractable to access, it impacts those seniors more, and it makes them more vulnerable than they would otherwise be. And no government should be allowed to do that. We tried to address that issue as well, that the overall service system navigation as part of the Toronto Seniors Strategy. We did a lot of things. I'm going to mention just one. There was an issue, our analytics at Toronto, at the City of Toronto, showed that there was a concentration of seniors living in social housing that were making a lot of telephone calls to 911. So we were trying to understand why they were making so many calls to 911 when it didn't seem like they actually had any emergency medical needs. So in partnership with the Toronto Paramedics Services, Dr. Samir Sinha at Mount Sinai, Toronto Community Housing, and other partners, we applied for funding from the Ministry of Health to hire 2 community paramedics that would go and knock on the doors of those seniors and have conversations with them about what kinds of formal and informal supports they had in place. They looked at their prescriptions. They really talked to them. And they connected them to all of the community and health services that those seniors really needed. So it turns out what they needed wasn't emergency medical care. What they needed was mental health and addiction. They needed to be connected to Meals on Wheels. They needed to know how to become eligible for an assessment for long-term care with the CCACs. And those community paramedics that we hired connected them with those services. The results were staggering. 49% of those calls were reduced in under 1 year. So the Toronto Star called this program Heals on Wheels, and we had our funding extended for another year. So that's an important example of the kinds of intrinsic efficiencies that can be gained when we look at the system, when we look at integrating the system services and looking at it from the perspective of the senior who is using those services and accessing those services. Those seniors could have called many numbers. They could have called 311, 211, they could have called CCAC, they could have called, but we as government make it very, very difficult for them. So that was only one thing that we accomplished as part of the Toronto Seniors Strategy. We have only just begun. We recently did a review of, there are 91 recommended actions in the Toronto Seniors Strategy, and after 2 years we did an analysis, and 86 of them, or 95% of them, were successfully implemented. That was heads and shoulders over what we had been able to accomplish over the prior decade of recommendations that frankly went nowhere. So we haven't stopped. We have created an accountability table. The University of Toronto sits on it. It's co-led by Dr. Samir Sinha and Councillor Josh Matlow. It has aging experts, community partners, caregivers, older Torontonians themselves, and we are working in a very dedicated and coordinated way to have a collective impact on this system. And we really are committed to making a demonstrable difference in the lives of seniors in Toronto. Earlier this year, we were honored to become the latest city to be designated age-friendly by the World Health Organization. And as I said, we really have only scratched the surface of what we can do. My mom is 90 years old now, and she lives in a long-term care facility, and she no longer recognizes me. I think she still enjoys my visits, and I think I still know how to make her happy. I can still make her laugh. But I sometimes think about some other more vulnerable people and how they would interact with that system and what their outcomes could be. So I want all of us to think about that map, because that's the map that will govern your life when you become a senior or someone that you love becomes a senior. Let's work together to make sure that we can all successfully navigate that system to get the services that we need in order to live longer and live better. Thank you.